Hello, my name is Dr. Shahad Abulanain, and I'm the correspondent for MedEdge MEA at the first annual meeting of the Emirates Clinical Chemistry Society and the Digital Health and Laboratory Medicine Forum held here in the beautiful city of Dubai. I'm very honored to be joined by Dr. Laila AbdelWareth. Dr. Laila is the president of the Emirates Clinical Chemistry Society. Welcome, Dr. Laila, and thank you very much for being here.
Thank you very much, and thank you for conducting this interview.
Lovely.
Thank you for being with us as well.
Thank you. It's my honor. Thank you for organizing this beautiful event as well. I'd like you to tell us more what sparked the idea, especially since it's the first edition.
Yes, it really is a very exciting milestone. We have a very young society, just composed the Emirates Clinical Chemistry Society, and very excited about this progress. And we were thinking hard, about our first event and how can we make this event impactful and meaningful. With our collaboration with the International Federation of Clinical Chemistry, our colleagues there from the IFCC suggested actually collaborating with the digital health subcommittee, which was a fantastic idea.
Right.
Because definitely laboratory medicine and medicine in general really is at the cusp of digital transformation, incorporation of AI and so on, and innovation. And we thought, what's a better way to start our first conference with a combination of course, laboratory medicine, science, but also highlighting digital innovation and AI. And this is how the idea started.
It's definitely a comprehensive meeting. You just don't have things related to clinical chemistry or laboratory medicine. You have AI included, like you said. So it's very comprehensive and educational and insightful to everyone.
Wonderful. Thank you. I'm glad.
No, I've heard very positive feedback. Everyone's loving it so far, and everyone's learning something new, which is really nice.
Well, that's the idea. Yeah,
that was it.
We wanted to bring new content, totally innovative and kind of like cutting edge, latest and greatest with
Right. Everyone's talking about the latest everything, so that's fascinating. So what are other takeaway messages you wanted the audience to leave the conference with?
Yeah, I think definitely the conference highlighted the importance of several key, I would say, transformative development within the field of laboratory medicine. Definitely genomics is one of them, the whole multi-omics as well, the digital transformation, the enablement of AI or the layering of AI on top of that digital transformation and all the abilities that will come to a laboratorian. I mean, if you think about the lab, we sit on a ton of data, mining this data in a meaningful way and generating, predictive algorithms, highlighting important progression in population health, and so on, to our doctors, to our policymakers, and so on, would be key achievements. So that was really the key, I think, takeaways is keep an eye on the development in the space of omics, on the space of digital health, digital transformation, and definitely the role of artificial intelligence, whether generative or non-generative artificial intelligence within laboratory medicine.
Right. The event was very fruitful. I'm sure everyone's excited about the second edition already.
Thank you.
So let's dive into biomarkers and Alzheimer's disease and neurological disorders in general as well. So if you can please introduce our audience to what biomarkers are and how are they integrated in Alzheimer's diagnostics and neurodegenerative disorders in general.
Wonderful. Thank you, Dr. Shahad. That's an excellent question. A biomarker basically is a biological marker. It's a surrogate that tells us that there is a pathological condition happening with the patient. Now, this biomarker actually could be a laboratory-based biomarker. It could actually be imaging-based biomarker. We learned today also even retinal scans could actually serve also as a biomarker for Alzheimer's disease. So anything that basically tells you about the development of a disease in the patient can be considered as a biomarker.
Right. Thank you very much for shedding light on that. Alzheimer's disease is always very challenging to diagnose early since the symptoms progress in a long period of time, and by the time they appear, the symptoms, they're irreversible. So how can biomarkers help us detect Alzheimer's or neurological disorders early to help the patient manage it faster and more effectively?
Yes, this is an excellent question. Again, so this is the whole excitement now about the field because, as you mentioned rightly, Alzheimer's is a slowly progressive disease. But the problem is by the time the patient gets to present, it's already has been maybe 10, 15 years in the making, maybe more. And if we were able to catch this early on at the onset of that disease and, the amyloid pathology developing, it will help us hopefully arrest even the development of this disease altogether. Now, the interesting development has been the analytical techniques that can measure those biomarkers in the blood. Before in the lab, we were able to measure those biomarkers related to amyloid pathology, and which is the early pathological issue underneath Alzheimer's disease, to measure the amyloid pathology and the tau pathology by using biomarkers but available in the cerebrospinal fluid surrounding the brain. The reason is the concentration there is high. We have the blood-brain barrier, so the concentration of the blood is very low. So the only way was to do a spinal tap and then to take that fluid and analyze it. Now, the fact that we have very sensitive and reliable analytical techniques enable us to measure the concentration in the peripheral blood. So we're able to measure very tiny little amount now with great accuracy, and that really, I would say, is a game changer in our ability to pick up the disease early and diagnose it early. And then the interesting thing is through the research and so on, and through the availability of all of these cohorts that researchers have studied, there has been few biomarkers that blood-based biomarkers that correlated very well with the CSF biomarkers, and then B, reflected amyloid pathology, and C, reflected that pathology very early on, before even the patient, so in the pre-symptomatic phase or in the preclinical phase, before the patient is even symptomatic. And this is why it is a true game changer here, because all of a sudden you have these tests that are almost going to behave like, a simple total cholesterol test, or a glucose check or something, and then you check, okay, you have this biomarker elevated. What could be the driver behind the elevation of this biomarker? What can we do to bring it down? And how can we prevent or even arrest this amyloid pathology if it is available or if it is present?
It's definitely revolutionizing diagnostics when it comes to neurodegenerative disorders.
Very true.
So neurodegenerative disorders, they're very complex and multifactorial. Biomarkers will help us in the diagnostic part of the disease. Do you believe that it will help us in understanding the technical mechanism and the progression of those diseases as well, or as we learn? Okay.
Absolutely. I mean, basically you have biomarkers that can reflect more about the pathogenesis of the disease and how it is developing. You have biomarkers to diagnose the condition, you're right about that. And then you have biomarkers to kind of like follow up even the effectiveness of the treatment and the trajectory of the patient, and even give a little bit of like prognostic indicators also. The whole idea here with this Alzheimer's disease is you have a state of basically neuroinflammation. And that neuroinflammation triggers the production of this amyloid material that is ultimately the key instigator of the whole process. So now the question is, okay, when we have this neuroinflammatory condition, are there biomarkers that are reflective of neuroinflammation? And the true answer is yes. We have the GFAP, for example, test that is an indicative of neuroinflammation. And then, as I mentioned to you, we have those biomarkers that are correlating very well with the amyloid deposition in the brain, so with the amyloid pathology itself. Now, if you want to also assess how severe is the condition, we have what we call the core-2 biomarkers, which sheds an eye or gives an idea about how severe is, or how severe is the neurodegenerative stage, and how far are we in this disease. Now, as we treat it, as we intervene, these biomarkers will normalize and will adjust, and that will tell us how successful or not are we with the treatment.
I think that's very important that we can get time-sensitive follow-up or updates about the patient's case, not just diagnose it early, but also be able to follow it up and know when to intervene and if the treatment is actually working for that patient.
Absolutely.
That's how it will help in personalized medicine as well. I heard a lot about it today. And
very, very true. It touches on personalized medicine for sure, because you tailor now the interventions and the treatment to suit that particular condition or pathology or risk factor that this patient has.
Right. There are many advantages of biomarkers, but everything can come with a little disadvantage or concern that arises later. From your experience and your expertise, of course, what do you think are some challenges or concerns that may arise with the use of biomarkers?
Yes, this is also an interesting question. So obviously with any laboratory test and with the introduction of these biomarkers, you have as a clinical characteristic of the test what we call the sensitivity and the specificity of the test. Mm-hmm. So the sensitivity of the test, meaning that would the test be positive in all patients with the disease? And then the specificity is, would the test be negative if the patient doesn't have the disease? Now, unfortunately, with laboratory tests, it's a trade-off. If you want the test to be very sensitive, that it picks up everybody with the disease, sometimes that takes away a little bit of the specificity of the test, meaning that it could also be positive in patients who may not have the disease. It is a very small percent.
Is that how you get the false positive in the...
There you go. This is how you get the false positive positives. Now, the NT-approved test so far that we have in our hands have a sensitivity of 97%. So it has a very good, what we call negative predictive value. Because it's very sensitive, it means if I test and if I'm negative, I have a very high probability that I don't have the disease. The specificity is not too bad. It's about 92%. But basically that means that I still have, 8% who I may call, having a disease, but really they don't have the disease. And that erodes a little bit, the concern and the positive predictive value of the test. So although the negative predictive value is very, very high, the positive predictive value is not as high, meaning that not everybody with the positive biomarker, meaning that this individual will have the disease. And this is the importance of what we call the pre-test likelihood. So this is the importance of not just doing this test on everybody, nilly-willy. We have to understand why are we doing the test, what are the risk factors, what is the pre-test likelihood, in other words, is this patient really at risk, is this patient symptomatic, does he have some subjective memory impairments or cognitive impairments, etc., and not just doing it on everybody blindly without assessing the pre-test likelihood to enhance both the positive and negative predictive value of this test.
I think the concern is for a really small number. So I think there is area to improve and overcome that. I am sure there is so much research going on to hopefully make it 100%. But thank you very much for highlighting that. since we're also talking about digital health in the conference, do you see AI or other technology being implemented in the same subject and biomarkers with respect to neurodegenerative disorders?
Absolutely, absolutely. So, in fact, there was one very excellent presentation about the use of AI, various applications to diagnose, also early detect Alzheimer's disease from retinal scans, also integrating MRI imaging with cognitive tests, with biomarkers, having those all in an algorithm, again, to predict whether the patient has this disease or not. So definitely AI will improve our prediction whether the patient has this condition or not, and particularly if you use multimodal sources of information. So imaging information, blood-based biomarkers information, some cognitive tests perhaps, etc., and feed this into the algorithm. It will increase the accuracy and the predictive power of this algorithm.
Definitely, that's very promising and an area we should all be looking forward to improving more. Lastly, if you can give a takeaway message to young professionals who are passionate about pathology and clinical chemistry and also want to integrate digital health into their practice, what advice would you give them?
Well, the advice is, again, watch the space. Read about artificial intelligence, get comfortable with the various terminologies and methodologies out there, experiment with it, experience it, because definitely it's the present, not always the future.
Right.
And definitely for young pathologists, it is going to, I think, redefine the profession, honestly. And if you are a pathologist who is not using AI, you are going to be replaced with a pathologist who is. So
I heard that a lot too.
Yes, today, because I really call artificial intelligence as really augmented intelligence. It definitely makes pathologists super intelligent, and super efficient. So definitely pathologists with these AI tools and know how to use them properly have an added advantage and an edge over those who don't. So now with the young generation here, we don't have to
worry too much.
Because you're already
we're invested in technology.
Very much into that.
Thank you very much, Dr. Laila. Dr. Laila, you're a great leader. You're helping bridge gap in clinical practice, research, and innovation. Thank you very much for organizing this beautiful conference and for leading the Emirates Clinical Chemistry Society into great excellence.
Thank you. Thank you very much, Doctor, for your lovely interview and for being with us today for 2 days.
Thank you very much.
Thank you.